Hi, this is Dr. Shurpaneni. I'll be discussing COVID-19 vaccine and therapeutics series. This will be a discussion about vaccines in our Part 1 series. Recently, FDA approved messenger RNA vaccines manufactured by Pfizer and Moderna for emergency use authorization. Pfizer's vaccine is a lipid nanoparticle mRNA vaccine with a modified nucleoside containing a SARS-CoV-2 protein spike. This vaccine was administered to participants in both US and Germany. Participants were 16 and older. The study design is basically a placebo-controlled, observer-blinded, one-to-one study where participants were equally divided between vaccine group and the placebo group, and out of the total population of 43,548 participants, there were about 37,706 participants who actually received the vaccine or the placebo treatment. These participants were followed for 2 months. After receiving their vaccination on day 0 and day 21, participants showed protective immunity around day 12 after the first dose and day 7 after the second dose. Authors concluded in the study that the vaccination was 95% effective with a confidence interval between 90.3 to 97.6%. Basically, the authors concluded that after administering the 30 microgram vaccine doses at day 0 and 21 resulted in neutralizing antibodies against SARS-CoV-2 virus and also robust response in T cell production like the helper T cell, CD4, and also CD8 antigen-specific T cells. Demographic of participants includes 49% were female, 83% were white, 9% were black, 4% were Asian, 28% were Hispanic, 35% were obese, 42% were ages greater than 55. So the vaccine didn't always work in everyone who received the vaccination. For instance, authors reported about 8 cases who developed COVID in the vaccine group after receiving their second shot of the vaccine, and the onset was about 7 days post second shot, and about 162 cases in the placebo group who obviously didn't receive the vaccine. Study investigators only reported minor side effects from the vaccination, like moderate pain at the injection site, headache, fatigue, and low rates of adverse events, which were comparable in both groups, in the placebo and vaccine groups. Moderna's phase 3 study, Coronavirus Efficacy and Safety, acronym COVE, study was a randomized, stratified, observer-blinded, placebo-controlled study. They enrolled about 30,000 participants, ages 18 and older. The demographic information includes 47% female, 63% white, 10% black, 20% Hispanic, 4% Asian, 25% ages 65 and older. Moderna investigators, for the purpose of randomization, used 3 risk stratification groups. Group 1 included ages 65 and older. Group 2 included patients younger than 65 with risk factors, at least one risk factor, and the risk factors were defined as chronic lung disease, diabetes, liver disease, cardiac disease, HIV, and the third group included ages less than 65 without risk factors. So the participants in the study either received 2 shots, 100 micrograms of mRNA 1273 vaccine, or the placebo shots. So the participants are expected to be followed for 25 weeks once they enroll into the study, and they're initially screened for COVID virus and also are ruled out for recovery from recent COVID illness with the antibody blood test. Once they qualify for the study, participants will be given vaccinations on day 0 and 4 weeks later the second vaccination is administered. Moderna reported following patients after their first vaccination by reaching out to patients on day 7, 14, and 21 prior to administering the second vaccination. At the end of 2-month interim analysis, since the initiation of the trial, Moderna reported 196 cases of COVID-19 in their participant group. Out of these, 185 patients were in the placebo and 11 patients were in the vaccine group. Therefore, the vaccine efficacy was 94.5%. Moderna also only observed minor side effects post-vaccination, like pain, redness at the injection site, joint, muscle aches, fatigue, headache. It's important to recognize that participants in both Pfizer and Moderna trials excluded patients who had prior severe allergies or allergies to vaccinations. Another vaccination we're talking about is AstraZeneca's AZD1222 vaccine, which were studied in about 23,848 participants across 3 different nations: Brazil, South Africa, UK. Participants were ages 18 and older. AZD1222, also referred to as ChAd-OX1 nCoV-19, is a vaccine that's derived from chimpanzee adenovirus, which is a replication deficient vector to help transfer the vaccine into human cells. The vaccine results in the 3 countries and combined shows that the vaccine is about 50 to 90% effective depending on the dosage used in these cohorts. Let's, for example, take the UK cohort, which included 11,636 participants, showed 131 positive COVID cases. Out of these, 101 were assigned to the placebo group and 30 in vaccine group, showing 70% efficacy. There's all sorts of allergic reactions, anaphylactic-like reactions in patients who have received the Pfizer's vaccine, and investigators believe it's due to an ingredient called polyethylene glycol. Polyethylene glycol, or PEG, is responsible for carrying the lipid nanoparticles of the vaccine into human cells. Therefore, the mRNA vaccines produced by Pfizer and Moderna are considered to be pegylated. Like FDA, National Institute of Allergy and Infectious Disease, are reviewing data among the patients who suffered allergic reactions and to see if these patients already have pre-existing PEG antibodies or simply reacting to the ingredient polyethylene glycol. Polyethylene glycol has several applications in both commercial, industrial, and medical industry. It's commonly prescribed as an osmotic laxative for constipation, can be found in skin and hair products. It's approved for pegylation of drugs manufactured by pharmaceuticals. FDA has already approved several medications that were pegylated, but not every patient that has been exposed to medications that were pegylated develop PEG antibodies. Their population who don't have any exposure to pegylated drugs still carry PEG antibodies. The prevalence is estimated to be between 40 to 70%. We just don't understand if having these antibodies increases risk of allergic reactions or anaphylaxis. Some takeaway from my presentation today. As we already know, both Moderna and Pfizer excluded patients who had severe allergies, and currently we are still trying to understand the level of concern related to PEG antibodies that could be prevalent in the general population. So the recommendation is to avoid vaccinations in patients who have pre-existing allergies. 2 vaccines, injections, or prior known severe allergies in general. Ideally, a person who may be at risk for anaphylaxis should be observed for 15 to 30 minutes post-vaccination.